for a lot of families, it is very bittersweet. You're losing kind of this comfort of knowing that your child's getting treated all the time and that we're attacking this disease that we've tried to attack for so long. You also lose a lot of the support that you have when you're constantly inpatient and with all the nurses and with all the other families that really become your friends. And so I think while obviously everyone is super excited to get to that point where you have no evidence of disease, you don't need any more therapy, there definitely are some bittersweet feelings that come along with it, and families often express that to us.
Long-term follow-up for patients, especially neuroblastoma patients, is extremely important for so many reasons. Neuroblastoma patients get a lot of different therapy, and those different therapies can affect them in many, many ways. They can affect them in so many clinical ways, but they can also affect them in a lot of psychosocial ways. So initially, the most important thing for follow-up after completion of treatment is monitoring for relapse of disease. So getting the routine surveillance imaging, whatever other tests that their institution may do, those are the most important things up front, right when therapy is finished. There are many other things, though, that can happen when therapy is done. But as time goes on, we are monitoring for other long-term side effects from their therapy. Some of those may include hearing loss, cardiac dysfunction from specific chemotherapy that they may have received. We also, though, talk to them about how they're doing in school, how they're performing in their outside life, how they're fitting in just in general outside of their hospital life. I think that we help navigate them through this post-treatment journey by just providing as much support as we can, by giving them information, providing the appropriate resources for them.
I think it's nice to remember that the reason that we know about the long-term side effects associated with therapy are that we're having so many more survivors than we used to have. And that there's also, because of that, so much research going into how we help patients, how we detect some of these long-term side effects early, and how we help to manage all those long-term side effects.